All right, good afternoon, everyone. Thank you so much for being here. I'm Elise Thomas. You likely emailed me to RCP for this event. And we are so grateful for your time and interest in minority health. It's National Minority Health Month. And we have a fantastic panel of experts, our local champions for health equity and the elimination of health disparity. And without further ado, we're going to kick things off with Dr. Gregory Hall. All right, tell us a little bit about yourself and you on the spot there.
Right. Oh, no, that's cool. I appreciate it. I'm happy to be here. So I've been holding back the history. We talk about where we've been. So my mother was pregnant with me at the grand opening of this building. Yeah, it's amazing. So she came and told me about it. So I'm going way back, right? But so she was here, and it was an amazing thing. I was born in 61. I don't know how pregnant she was, all right. But it was a bunch of Black doctors who got together and put their money together and built this medical building, which was really a landmark thing. And it was designed by a Black architect, Madison. And so since my father was friends with one of the Madisons, they came to the grand opening. And so it was really a big deal. Doctors taking care in the neighborhood, taking care of their patients. I went away to grew up, went to medical school, did residency, Cleveland Clinic, and they said, we wanted me to get a job at Cleveland Clinic. And I said, no, I'm gonna go back to my neighborhood and be a doctor. My father said, you're crazy, but I did. And so guess where my first office was? Right here, 301, 1464, room 301. Isn't that crazy? And so that's my second time coming here. Right? I was a little bigger. And so now to see that address, that coming here to see it kind of reborn again. My office was right on the front, looking right on 105. I can tell you all the stuff we saw. But it was sort of exciting. So it was great to be back here. Back in 1960, when my mother came here, the life expectancy for African-American males was 59. So I'm a couple years past that now. Thank God that we've extended that life expectancy. But if things hold firm, I only got like 9 years left, right? Which is crazy. And so this life expectancy thing, as it relates to African-American men, is significant. So life expectancy 73. If we kind of ignore COVID and all the bad news, and we think it bounces back to where it was. For white Americans, it's 78. For Hispanic Latinos, it's 82. And for Asian Americans, it's 86, right? And so one of the things I keep saying is that some of our health disparity problem is really not so much a minority problem as it is an African-American problem. And so like first year Cleveland showed us, by taking a laser focus on African-American women, they were able to finally make a difference in those disparities. And so these are one of the things that we want to do in terms of increasing health literacy and getting rid of conspiracies. I mean, we think about what I've lived through here, the Glenville riots, right? Someone reminded me when we were going to Paris, my wife's birthday, they said, they're rioting in Paris. I'm like, I lived through the Glenville riots, they came and now they riot, they do quite a riot here, none of this, we were rioting. They had a tank came down St. Clair with National Guardsmen kind of at each corner, rode down the center of St. Clair Avenue. And I saw that, and so living through that, thinking about the Twin Towers, I kind of thought the world was coming to an end for a moment. That things, when the planes hit the Twin Towers, I was going to come. I think I was coming here to see patients, and I canceled them at the last minute. And now, guess what we just lived through? A worldwide pandemic. Isn't that amazing? So you think the things that you'll tell your children and your grandchildren, these major events, and then we got to the other side of it. Somehow, I almost didn't make it to the other side of the COVID. I really almost didn't make it. But I did. But boy, all the people that I lost, my patients that I lost, but the strong ones are here. We're here. And some of that is because we have faith in reality. Some of it is health literacy. And I keep saying, and if you don't even use literacy, it's health. So, and it's education. So people with degrees, medical degrees, graduate degrees live longer than people with master's degrees, live longer with than people with bachelor's degrees, live longer than people with high school diplomas, that live longer than people with GEDs, and they live longer than people who don't have a GED. So it's exact health and education go hand in hand. And so the more education you have, the more you understand how the things that you do can affect your health. And so I've made sort of my first thing was like, I'm just gonna make sure everyone has all the right medicines, and I'm just gonna make sure they see a doctor. Blah, blah. But now I'm thinking, no, I really need to think about what do people know about their health, and what do they believe, and what do they don't believe. You know, I tell patients, well, I believe this and I believe that, and I don't believe that. It's like, how can you randomly decide? You know, these are all facts to me, but you're taking these two, but you don't like that one. You know, that's counterproductive, and that's hurt us in a lot of different ways in terms of helping us to understand that we can't just decide what reality is in a vacuum. There are people out there that decide that, yes, this is the truth. Yes, the sky is blue. Yes, you know, vaccinations help. Yes, there's side effects to some, you know, and so those type of messages, we have to be able to earn the trust of the Black community again, and be able to try to really advance people who don't know, and let them know we're not trying to hurt you. We're not trying to pull wool over your head, but we're really just trying to make things better. So I'm the medical director of the Cutler Center for Men. We're specializing specifically in the health of men. The women in here know that most of the men that come and see me have a woman outside with a gun on their shoulder. You know, those gun things are no good to talk about anymore, but they've all been made to come. Most all of them. Very rare, very rare. The woman didn't make a man come see to the doctor, right? And so we're leaning in at the Cutler Center to try to find ways to engage men in ways that they make it not so distasteful to go to the doctor. And so when I had my physical to start at UH, I went to get my blood drawn, and I gave a little requisition, and we just sat in, and the room was probably this big. And they came to the door and said, Gregory, and I wanted to shrink. I hated that so bad. You know what I mean? And so men don't want, you know, women's like, get the purse, get them, go. You know, and you hate this, but it's like, I don't want my name screamed out at the doorway, you know. And men know, we start figuring out how are we going to do the Cutler Center. We find out men don't like that. You know, men, I don't like to wait. Men don't like to wait. You can't do a broad stroke, but so the Cutler Center is really trying to take a look at what men like and what they don't like, and try to lean into that. There can be pool tables there. There's going to be pool at a Hoosier. It's going to stadium seating. You know, it's going to be, and people are going to come and get you when it's time for your appointment. So the person, everyone's got to have a picture. And they're going to get up and see, okay, it's going to go. I'm doing our job. Thank you so much. That's what I want, right? And so the Cutler Center for Men is really transformational. And we have Randy Bentz, who's our minority men's medical director, outstanding urologic, oncologic surgeon. Charles and I are just saying the next generation of health disparity workers for us. And we're really proud to have him. And we want to really invite people to have a primary care doctor. That's one of the things we're really we're stressing. Everyone deserves a primary care doctor, and men particularly. Getting their care in an urgent care or an ER is horrible, horrible care. And then the doctors here know that we don't think much of emergency room doctors. You know, they just follow route. You know what I mean? I'm always gonna say something crazy, but they you know, it's just, if you shot, you want an emergency room doctor, right? You have a stroke, you want an emergency room doctor. If you have any other problems, they're no good to you. And they're not interested in being any good to you, really. You know, just know that. And so going there, people think they're getting care by going to the emergency room, and they're not. You need a primary care doctor. I've had my blood drawn. They did not draw your cholesterol in the ER, right? They didn't. So you haven't had your blood drawn, really. They didn't check a PSA in the ER. And those are the things that we need to do. So where we're going, we're looking forward to opening in the fall at the Cutler Center. We're going to be coordinating research as it relates to best practices in men. I've just gotten University Hospital, and Angelique Doritas McCoy knows that they've approved the UH Center for African American Health. which we're gonna be working on. So that's coming in third or fourth quarter of this year. And so that's gonna be taking a laser focus on just the care of African Americans, the way the first year Cleveland did. And one of our focuses is gonna be health literacy, advocacy as it relates to lead and things that are really causing problems, and education, just really letting people know. So I hope I didn't time myself, but that's me.
Perfect. Thank you so much, Dr. Hall. Next up, we have Dr. Charles Conley, and we will kick it off with a,
Well, I'll tell you.
okay.
So Dr. Greg Hall is a tough act to follow. I don't think I can